Breast cancer is the most common malignancy diagnosed in females, and it is also a success story of screening programs. So it's extremely important for all women to discuss with their primary care providers the screening guidelines and undergo the recommended mammography at recommended intervals. After being diagnosed with breast cancer, it's very common to experience fear and uncertainty. Patients should have a very detailed discussion with their surgeon about the surgical treatment options, as well as what will happen after the surgery. When women choose to preserve their breast and undergo what is called breast conserving therapy, radiation plays a key role in this in the postoperative setting. The goal of radiation in the setting of breast conserving therapy is to clear up any microscopic cells that may be left over after the visible tumor has been removed by the surgeon. When we treat breast cancer with radiation, there are several different regimens that we may pick from with regards to how long the treatment is delivered. However, this is very individualized to a patient's characteristics, and it is important for them to discuss this in detail with their radiation oncologist. Breast cancer treatments are constantly evolving and improving. The radiation for breast cancer that is delivered today is quite unlike the radiation that was delivered 20 years ago. We now employ new technologies not in only how we plan the radiation, but how we deliver it. And we know with breast cancer that we need to take all the steps necessary to minimize any excess radiation going to normal tissue. One of the most important organs that we are trying to spare with radiation treatment for breast cancer is the heart. The heart lies in the middle of the chest and actually varies in position depending on where in the breathing cycle you are. We now have the ability to coordinate the delivery of radiation to the cycle of your breathing so that it is only delivered when the heart is furthest away from the breast tissue, thus minimizing any exposure to the underlying heart to radiation. So for anyone facing a cancer diagnosis, in our practice, we want to help support and inform you during not only the treatment process, but in the important follow-up period afterwards, survivorship.